Today is Wednesday, and this is just an update on our current status at our facilities and what's going on with the COVID-19 virus. First of all, just want to again say thank you for all your help, your work that you're doing, the way people are assisting with us, and this goes out to our residents, our families, and our coworkers as well. At today's resident council meeting, I asked the resident council members what topics would you like to have covered, and so following is some of the things that they have brought up that I'll try to address today. First, and very important, we do not have any COVID at any of our locations, and our locations again would be our villas, the apartments, the Courtyard Assisted Living, Clarkson Healthcare, and West Hills Village Healthcare. Even with that, though, we have been doing some testing of residents and staff if and when they meet the criteria that the state has to be tested. And again, all of those have been negative for COVID-19. First, an update on our licensed facilities. Each of these areas, which again would include the Courtyard, Clarkson Healthcare, and West Hills Healthcare, fall under the rules and regulations of the Department of Health. And the Department of Health has not made any changes with what is allowed in the steps and processes since the last time I updated you. And if anything, we expect to see some new rules and regulations possibly yet this week. As I'm sure you've heard about the concern nationwide about people who have been passing away in skilled nursing facilities and assisted living facilities. And of course, this is because they are the most at-risk population we have in the United States. So in terms of answering questions about when can someone come visit, if I'm at West Hills, can I go visit? The answer still is no, and it's being mandated by us. And again, we don't expect that to change anytime soon for a number of good reasons that I'll cover as we get going. On the good side is we just received the new updated CMS ratings, and once again, Clarkson Healthcare and West Hills Healthcare are 5-star rated facilities. You cannot get any better than that. And that's a huge thanks to our tremendous leadership team that we have at our locations and all the care that and services our staff give on a daily basis. Another question that came up is, why is it critical that we know if you're leaving the facility, where you're going, when you're going throughout the week? Well, the big critical component to us is this is going to happen as follows. Someday, it could be an optometrist, it could be Safeway, it could be anyone in town is going to announce that they have COVID-19 virus at their location. We are going to want to know right away, any of you who have been anywhere, so we can do the quick follow-up. If you can imagine, what we're trying to do is make sure we have a very good understanding of what's going on, because when it's announced that a certain place has COVID, we've got to track that back to our staff, the residents, and anyone else who's been at our facility to limit the exposure to the rest of the people here. So a month or so ago, the cancer care treatment place announced that they had a staff member who had become diagnosed with COVID-19. Within minutes, we were running through all of you to determine who has been to that complex, and we were in contact with each and every one of those residents and in some situations family to find out when you were there, who you saw, this sort of thing. That's why it's just critically important that we know what's going on, because it's probably not going to be a matter of if this happens, but when it happens. So we appreciate your cooperation with that. Dining room seating. We continue to have tables spread out in limiting seating based on who's in the apartment. We need and have to continue to do it this way. We can't make any changes with dining, allowing more people to sit at a table than we currently are for very good reasons. As soon as we're comfortable in making those kinds of changes, we will be happy to let you know, but at this time we're not able or allowed to make any changes in the dining room for that. Also brought up at resident council meeting that we really need everyone's support, meaning residents' support, in having your mask on, practicing good hand washing, and practicing the social distancing that we've talked about time and time again. We have some mixed results with this. I would say the vast majority of our residents are doing a good job, but we've got some who aren't always doing the job. And remember, this COVID-19 is a different kind of virus than any of us have experienced before here at the facility. And once it does go, it goes fast. And as we look at the entire population of West Hills, it is all vulnerable, age-wise, and we have lots of people in apartments and villa settings who have other underlying health issues. So part of it's to protect yourself, the other part is to protect the others around you. So please help us with that. So a little bit about COVID in our community. And the science behind it in our conference calls when we have with physicians, hospitals, Department of Health, you may find this of interest. The total number, daily number that we were getting hasn't changed much. The reason we maybe get a little dull to the numbers is the Smithfield outbreak in Sioux Falls really skewed the numbers. And so what they're doing as they're measuring the COVID-19 and projecting in the future, they're looking at new cases out with the outlier of the Smithfield thrown out. And when you look at it in a way of what's going on if we take the Smithfield case out, the numbers are increasing both in our community and across the state. And so we have now approached that time that we've been talking about for months, that it's going to get here and we're going to continue to see it grow. We are now there, which then impacts why it's critically important that we keep doing what we're doing, at least for the near future, until we can have a better understanding of where the numbers are at and where they're going before we start to loosen any kind of restrictions and practices that we're seeing. It also shows you why the health department probably is going to put new rules, regulations, and stipulations in skilled nursing here in South Dakota, because the numbers are increasing. So the important thing is we need to hold the course, at least for the next few weeks, to see what we learn. We'll know it when we know it, as will others around as well. We are looking at ways to allow some facility visitation outside once the weather improves. So when we get to the point that we think we can start doing this, we'll keep you informed. We plan to implement something at Clarkson Healthcare, West Hills Healthcare, the Courtyard, and here at the Independent Living. But more to come on how that will occur and when it'll start. The bank currently is closed. One of the questions brought up was how can you get cash? And what we understand is if you call your bank, they can work with you and them in our office, and we should be able to help you out with that. This week we started beautician services on a limited basis, and we'll continue. The beauticians have been very supportive of self-isolating and doing the screening. And it's just critically important that we follow the guidelines that we've established for use of those services so we can continue to keep those in place. As we look towards the future, some things that will become critical as we begin to open up is testing. And so some of the science behind all of this is that when South Dakota gets to the point that they can do more testing of all of us, we'll be in a better position to know where this virus is at, who has it, and how we deal with it. Until such time, we're all working in the blind. We don't know until after the fact. So that again emphasizes why we need to continue to do what we're doing. Another part of our ongoing work behind the scenes is looking at how do we come out of this, and what does that look like for those of us who work here as well as those who are at any of our facilities and your families and friends. And it won't be as simple as when we shut the doors and said no visitation. Don't expect the doors to open up and now we're back to complete visitation. It's going to be a hybrid of how we slowly come out of this and allow you to work within the new rules that all of us will have to work within, as well as our staff, as well as your families. And more to come on this, but just be assured that we've been meeting with physicians and listening to others who have been through this, of how do you come out of this. We're not there yet, but knock on wood, hopefully we'll be there soon. So I'm going to wrap that up for today. If you find this of interest, let the front desk know, and we'll continue to do this as well as the letters that we've been putting out. Again, I give everyone high regards for the great attitudes, great support and teamwork on all areas. You as residents, our staff members, and everybody's family. We're all in this together. We've done a good job so far. We need to continue to do a better job in certain areas of your participation, and we need to hold the course until the Rapid City community shows that we're past the growing stage of COVID-19. So thank you. We'll look forward to seeing you soon. And again, we appreciate your help. Thanks.